Hello, everyone. Welcome to the Investor Tech Health Pitch Competition. All right, c'est Karel qui est avec nous. Nous songeons que nous te passons un bon moment semaine passée et jeudi, c'est pour le même bagay là. I'm once again honored to be with you, to be your host for tonight. This is the second of a series of 3 pitch competition of the Diaspora Partnership Accelerator DPA of USAID and Haiti Renewal Alliance, an organization that promotes diaspora engagement for the sustainable development and investment in Haiti. The Diaspora Partnership Accelerator DPA is an initiative of the Bureau of Humanitarian Assistance at the USAID to fund diaspora project. The Investor Tech Pitch Competition is a component of the DPA implemented in partnership with Haiti Renewal Alliance. Once the competition is over, the Bureau of Humanitarian Assistance will tap into other partners to work with the winners in implementing the projects. This is really important. Il faut que je dise ça en créole. Compétition ça qui a fait là qu'on chaque organisation, on grande organisation dans chaque catégorie a gagné $1,500 américains pour implémenter projet yo. Mais bureau Humanitarian Assistance dans USAID après le travail avec l'autre partenaire, même bien le travail avec Haiti Renewal Alliance pour qu'on y ait capable d'implémenter projet yo. En façon pour que compétition ça pas juste une compétition, mais projet yo vraiment réalisé dans la communauté que gagnant yo promettent que y a pral implémenter yo. So, as you know, the competition has 3 categories: agribusiness, health, and shelter. You will find more information if you go online on the website investortech.org. There's a lot of information about there. You can learn about the contestants, see the pitches, and everything about the competition. Tonight is all about health. C'est la santé. Il y a 5 organisations qui pourraient participer. We have 5 organizations. Community to Community, FAHM, Gaskov, Haiti Healthcare Aid, and Hope. All those organizations, they will pitch the project like we did last week in front of our judges, and only one will have the opportunity to win $150,000. Last week, we had a great show. Thanks for all your feedbacks. It was the agribusiness pitch competition. And there's no doubt that tonight is going to be as good. I have to mention, mais vraiment, nous avons plus que 8,000 votes pendant semaine ça. And I hope that the health category will top that this week. Now it's time for me to introduce Mr. Mike Disisti of the Office of the Global Policy Partnerships and Program and Communication at the Bureau for Humanitarian Assistance at USAID for his welcome remarks, followed by the judge's introduction.
The notion that unity is strength, so central to Haiti's origin story, is an ideal that underpins USAID's unwavering commitment to the nation and its people. Even with recovery and rebuilding efforts underway, we continue to work collaboratively with our partners and diaspora communities to meet the needs of the Haitian people, both in the short and the long term. USAID's Bureau for Humanitarian Assistance, better known as BHA, provides life-saving assistance to the world's most vulnerable people in the face of conflict and aftermath of natural disasters, including the devastating earthquake that occurred in Haiti in mid-August. But humanitarian needs such as food, water, shelter, emergency health care, sanitation and hygiene, and critical nutrition services consistently outstrip resources available. This is why innovative approaches and new partnerships, including the one with diaspora that brings us together here today, are so critical. Diaspora engage as humanitarian actors in a number of ways, through transnational social networks, transfer of specialized skills, sharing of knowledge in local context, and remittances. Partnerships with diaspora can not only advance efforts to make aid delivery and impact more effective, but they help bridge the humanitarian development nexus in order to achieve more sustainable outcomes. Today, you'll get a glimpse of one of BHA's diaspora partnerships in action. Through the Diaspora Partnership Accelerator, or DPA for short, the Bureau for Humanitarian Assistance is funding the implementation of diaspora-led projects in 3 sectors: shelter, health, and agribusiness. The Diaspora Partnership Accelerator is an 18-month initiative designed to pilot innovative and collaborative partnerships between BHA and diaspora groups. In conjunction with local actors and affected communities in Haiti, Haitian diaspora organizations identified and designed innovative solutions for some of the nation's most pressing challenges related to disaster risk reduction and humanitarian assistance. From 52 diaspora organizations that applied, 13 were shortlisted for this competition. These shortlisted projects demonstrated innovation, the promise to deliver significant impact, and proposed a well-defined strategy to achieve objectives. Beyond the Diaspora Partnership Accelerator, BHA is dedicated to engaging with diaspora to leverage their innovation, skills, and resources to better address the humanitarian challenges facing our world today. We've established a growing team in the Bureau specialized on building bridges with diaspora communities and on expanding program opportunities around diaspora humanitarianism. Across all of our programs and activities, BHA aims to create openings for improved coordination between diaspora humanitarians and institutional humanitarian partners. I want to applaud all of the contestants who have worked tirelessly to design activities relevant to the needs of Haitian people that are doable within the allotted project timeframe. Each of you have earned your spot among the pioneers of this innovative initiative. With all sincerity, you are all winners in that regard. And for the select few who receive additional support to implement their projects, take this opportunity to show the world that diaspora community engagement and humanitarian assistance is possible, essential, and most importantly, impactful in both the short and the long term with sustainability in mind. Let me close by reiterating USAID's heartfelt gratitude to the contestants and organizers of today's event. By working together, exchanging ideas, and contributing to a collective outcome without insisting on owning it, we can build a stronger Haiti together. Unity is strength. Thank you and good luck.
All right. Welcome back, judges. Good to see you again. All right. And of course, maybe there's people watching for the first time. Those are our 5 judges for the competition. They were there last week judging the agribusiness speech competition, and they're again here tonight for the health pitch competition. We have Daniela, Itop, Jessica, Raymond, and Evelyn. I'm gonna start with Daniela. Hey, Daniela, how are you tonight, and how are you feeling? What's your expectation for?
Hi, Terrell. Nice to see you. Nice to see all the judges again and everyone who's watching. I'm excited to be here. Looking forward to this next round of pitches. The first pitch last week was a tremendous success. I'm so excited to hear all the feedback that we're getting from the audience votes. So I'm excited to see what comes this week and hear more about the health projects. So thank you.
Perfect. What about you, Etop?
Yeah, same here. Excited about another opportunity to hear some great pitches and select a awesome company. Amazing.
Good. Jessica.
Hey there. I'm glad to be back. I was really impressed with what I saw last week. Can certainly feel the energy in the virtual room. So really looking forward to hearing from the participants tonight. Good luck to everyone.
All right. Raymond.
Yeah, Kyle, same here. Really looking forward to hearing from these 5 great organizations that are working directly underground, making an impact on these vulnerable communities. So, the healthcare sector is extremely important. So, excited to hear those presentations.
All right. What about you, Evelyn?
Well, bonsoir, everyone. Great to see you. I'm so excited to be back here again on this technical evaluation committee. And I know tonight's projects are going to be very interesting. I'm looking forward to seeing how many of these diaspora communities are applying innovative practices towards improving lives for many people in Haiti. So good luck to all of you. And, let's get this ball rolling.
All right, let's do this. The judges are ready. And before we get to the first speech competition, I think it's important for me to remind the audience and also the participant the competition rules. M'envie justement que nous connaissons comment la pral dérouler à soir, puisque nous connaissons que chaque organisation a pitch, il y a des chances de répondre une question juge pral voter pour yo, et après n'a capable de résultat, mais après résultat à partir de minuit à soir jusqu'à dimanche, ou même dans l'audience on capable voter pour projet qu'on pensait qui méritait gagner compétition. So now let's watch the rules, and we're coming back for community to community.
The winner of the competition will be the organization which accumulates the most amount of points. The maximum total score is 200 points. 150 points allocated from the Technical Evaluation Committee, TEC, and 50 points allocated from the public voting. The Technical Evaluation Committee will account for 75%, while the public vote will count for 25% of the total score. The Technical Evaluation Committee is composed of 5 judges. Each judge will tally their score for each project after each pitch. Scores will be calculated based on 10 key indicators for the project pitch evaluation: assessment and scope of needs, engagement, management, innovation, feasibility, planning, project impact, disaster risk reduction, sustainability, and presentation. Each criterion will receive a score using a 3-point Likert scale: 1 equals disagree, 2 equals neutral, 3 equals agree, for a total score of 30 points. The judges' scores will be tabulated to give the pitch a total score of maximum 150 points. The public will have an opportunity to vote for their favorite project after each virtual pitch event. The voting process will start at midnight after each event and will last 5 days. A score of up to 50 will be included in the final score based on the accumulated vote from the public. Highest vote scores 50. Second highest vote scores 45. Third highest vote scores 40. Fourth highest vote scores 35. Fifth highest vote scores 30. The public score of 50 will be added to the TEC score, 150 points, for a total score of 200. Let's consider 2 projects, Project X and Project Y. After its presentation, Project X has been given the following scores by the judges: Judge 1, 25, Judge 2, 30, Judge 3, 28, Judge 4, 20, Judge 5, 17. Project X accumulates a total of 120 points. After its presentation, Project Y has been given the following scores by the judges: Judge 1, 20, Judge 2, 18, Judge 3. 27, Judge 4. 25, Judge 5. 26. Project Y accumulates a total of 116 points. After the public vote, Project Y finishes second with a score of 45 points. Project X finishes fourth with a score of 35 points. At the end, Project X accumulates a total of 155 points, and Project Y accumulates a total of 161 points. Although Project X has a better score from the TEC, Project Y ends up winning because it has been voted more by the public. For more information, visit investortank.org.
I am Marie-Hélène Toms, the CEO and founder of Community to Community. We create self-sufficient communities by working with the community. We are based in New York, but our hearts are in the rural mountainside of Petit Guave, Haiti. Our community members walk 2 hours one way down the mountain to seek help at the hospital. Some have died in childbirth, in cardiac arrest, and for untreated illnesses while en route. We created the Continuous Care Initiative to save lives and to bring 1,200 families consistent care via 1 Haitian doctor visit per month, 1 Haitian nurse visit per week. We have held visits during hurricanes, under tents, under tarps, under the sky. With the capital from the HRA Investor Tank, we will construct a permanent home for the Continuous Care Initiative, adding a birthing center, wellness programs, and a small business development workshop, creating a sustainable, healthy, economically vibrant mountainside community.
Avant nous te gen soin kontinyan, santé ya li pat facile pour paysan yo parce que yo déplacé yon nombre de kilomètres yo avant yo joindre soin yo kon getan mouri même nan route. Fi ka fait petit, yo kon pote yo se sou branca, durant temps sa ti moun nan getan mouri nan passage.
Par rapport CDC vin nan zone avec soin, on se soulager en pile et nous comptons en pile parce que là nous prend malade c'est tigre nous kan al prendre soin et nous prend soin dans zone noire.
Et nous ka boy gen un dossier que n'a regardé kounya là nous voyons que amélioration qui fait. Des monde qui te kon gen tension qui haut par exemple, m'gon dame qui te kon toujours gen tension li 20 par 14. Donc mois de mai, il était venu tension il était 20 par 14. Mois de juin, il est venu tension 16 par 9. Je dis attention 14 par 9. Donc ça lui-même est vraiment important pour qu'après évolution comment ça lui-même marcher et avec l'éducation que nous baillons nous est que ça lui-même vraiment marcher. Donc ça c'est une bonne initiative.
Et soins continus en lui-même, c'est sens ça. Ça veut dire n'a pas un soin, c'est pas un soin chaque année, c'est pas un soin campé là. C'est chaque mois nous venons nous en quantité de monde, mais un projet a plus gros que ça qui commence là qu'on y a.
Nous dans une zone qui est vraiment isolée côté l'État, pas même connaître si monde ça exister, parce que pas même un centre de santé pour qui t'a ba monde ça même un vaccin. Donc avec aide nous ka boue monde ça yo en paquet monde te cap mourir nous cap diminuer taux de mortalité dans zone ça. Merci.
Bonsoir, Investor Tank judges. Imagine waking up in pain, needing medical attention. Would you walk 2 hours down a mountain? Our mountainside families face that question every day. This is more than just a problem. It's a humanitarian crisis. I am Marie-Hélène Toms, the founder and CEO of Community to Community. In 2017, we partnered with the Peasant Association, created a health survey, and launched the C2C Continuous Care Initiative. Our health survey found high blood pressure and diabetes as issues, and if a mobile clinic came, it created a herd-like mentality, provided no follow-up, and patients ran out of meds. The solution? The Bona Duisel Health and Wellness Center to expand the current Continuous Care Initiative of 1 local Haitian doctor per month, 1 nurse per week, and a 1 trained community health team living in the community. The center will be off-grid. Please return to the previous slide. Thank you. The center will be off-grid, solar-powered, pharmacy-equipped with medication storage, earthquake and hurricane resistant, serve as a shelter during natural disasters, adhere to disaster and emergency response unit protocols, regular drills for staff and med personnel. It will provide comprehensive health care for 1,200 families and increase the revenue stream for the Peasant Association. Our innovative method is what makes us unique. The old way, international medical teams, free meds and services, seeing different doctors inconsistently, engaging in medical services as a last resort or for emergencies, minimal knowledge transfer, capacity building, and no disaster risk reduction plan. The C2C way, local Haitian medical team, community members purchasing their meds and services, seeing the same doctor regularly, engaging in healthcare for education and prevention, capacity building, CPR first aid training, small business development workshops, and DRR protocols. Because we are not a hospital or mobile clinic, the closest thing we have to a competitor is the hospital 2 hours away by foot. We actually work with the hospital by referring patients to them. Our solution is better because it is consistent, affordable, time-saving, trust-establishing, and revenue-generating. Our mission, creating self-sufficient communities by working with the community. The last line in this poem says it all. When this work is completed, the people will all remark, we have done it ourselves. Our market is 9 communities of farming and small cottage industry businesses making approximately $50 per month. Ailments range from high blood pressure, diabetes, and typhoid. The needs are clear. Access to local, affordable, consistent, comprehensive health care and education. C2C has received press and recognition, but our real milestone is the trust developed through the collaboration and the data that shows that our Mountainside partner community is getting healthier. Our revenue model is based on a proven concept. The Peasant Association facilitates the doctor visits. They have charged since the launch and gradually increased fees from $1 to $5 for doctor visits and $5 to $10 for labs. We want to scale with volume. Net income will be reinvested into the center, and the cost to patients will range from $5 to $19. However, the Peasant Association will create a sliding scale. This investment will lead to the construction of the center, ensuring it's up to seismic and DRR codes, capacity building and training for the Peasant Association and the health committees, and small business development workshops for the community. Our team is ready. The center is named for 2 Peasant Association members who were killed in the 2010 earthquake, so the community is a committed stakeholder in its success. The center's impact will reverberate from mountain to mountain, creating self-sufficient communities. Charity is not the solution to poverty. Prosperity is the solution to poverty. Healthy people prosper. Thank you.
That's it. I love it. Good job, Marie-Yolande. Great presentation.
Thank you.
Now it's time for the judges to ask you questions. I'm going to stop with Evelyn.
Hey, Marie-Yolande, thank you so much. Great presentation.
Thank you.
So I have a question. You mentioned that you work in collaboration with a hospital that's 2 kilometers away from where your project is located, and that this hospital could also be considered your competitor. So my question is, have you thought of how you could potentially coordinate with the hospital in the event of a humanitarian emergency? And if so, what would this collaboration look like?
Excellent question. I'm very glad that you asked this. So as I mentioned, the hospital really isn't our competitor in the sense that when folks are too sick on the mountain, we end up sending them to the hospital. Okay. Number one. Number two, due to the fact that Haiti is prone to natural disasters, C2C has developed an emergency management alert system, which includes the following in the event of a disaster.
personnel and phone roster, a WhatsApp group to disseminate important information in the event of a natural disaster between medical personnel, staff, the administrative leader here in the US, and the hospital. We would be stocking up on small supply kits and go bags that would last about 3 days, maintain an evacuation route, shelter in place guidelines, and communications plan between the local hospital and our leaders.
Thank you.
All right, perfect. And we're moving on with Raymond.
Great. Yeah, Mariola, and I say great presentation to echo Evelyn. And I saw in your presentation that you've proposed reducing the healthcare costs for your target community from $178 to an average of $5 to $19. This is a significant reduction. So beyond this funding period, how do you plan on continuing funding the healthcare center with such a high reduction in healthcare costs?
Very good question. We get asked that a lot. So this gives me an opportunity to break it down. The 178 was estimated, right? Meaning from the mountain, catching a motorcycle taxi down, going all the way to Port-au-Prince, or sitting at the local hospital for hours, buying lunch, getting doctors visits, purchasing medicine, etc. The folks on the mountain can't afford the 178. So we're clear. They were not paying that to begin with, right? But oftentimes they will save up for months just to be able to go as far as Port-au-Prince for help. Our survey showed, and because we have been charging since 2018, that this is the amount that they can pay. So it's already sustainable, right? We're already doing it. And year over year, we've increased, the Peasant Association has increased the amount that folks would pay. So sometimes a person might need the doctor's appointment. Sometimes they might need labs to find out if they have typhoid, malaria, or H. pylori tests that they would also do. We're also connecting with the health ministry in order to be recognized as a hub. So if someone does have malaria, they would also be able to get additional treatment. I hope I answered your question.
Yes, thank you.
Okay, good. All right, Daniela.
Hi, thank you very much for your pitch. One question for you, please. How will you ensure that your project services are accessible to those who are most vulnerable to disasters?
Well, the location literally makes it the most accessible. On the mountainside now, there is no center. There's no access to any health. They would literally have to leave the mountain to go down to either Petit Grave proper or neighboring areas, which are now 4 hours away. So during a disaster, the location will be a shelter for folks to get to. It is literally a 10 to 15 minute walk pretty much in all directions. And also the health committee would be going out to folks that may not be able to come to us to go get them and bring them to the health center.
Thank you.
You're welcome.
Jessica, it's your turn now.
Yeah, thanks also for the presentation. I wanted to ask a little bit more about the staffing piece. It sounds like the on-site medical team is really critical to your model. Can you talk a little bit more about how you're identifying and training the right people to be on that team?
Absolutely. Thank you, Jessica. The Peasant Association itself consists of technical folks, civil engineers, 3 nurses, and we also have Dr. Mariel and Dr. Peter, who've been with us since the beginning as well, who will act as vetters with the Peasant Association, looking towards having local doctors and local nurses. So we have a vetting process that they will go through before they engage with the community.
Got it. Thank you.
All right, perfect. Thank you, judges. Can we move on it up? You don't have any questions?
Yes, I do.
You do? All right, perfect. Good.
Yeah, so just looking at the previous work that you have done in Haiti, do you know prior to requesting the funding for this event, how much has been spent on the Haiti Restoration and Transformation pilot project to date?
Overall, you mean since 2010 or in this last year?
Either, if you have the numbers.
Well, in the last year, our budget is around $100,000. And that's for all of the initiatives, not just the continuous care. This is the water distribution system, our environmental rehabilitation. I'm missing one. We're still raising funds for the school building, as well as a latrine initiative and a goat initiative that we have for the farmers as well.
Thank you.
You're welcome.
All right, perfect. Thank you, Marie-Hélène. Great presentation. And now the judges will score. And we're going to give you a teaser of what's coming next week. And we're coming back for the second pitch for tonight.
I'm incredibly proud of leading a team right now, the DART, the Disaster Assistance Response Team. And I'm proud that folks have rolled up their sleeves, willing to get out in dangerous situations, flying throughout the country, probably working 16 to 18-hour days, but working together, no complaining. Everybody's just, how do we work, coordinate our efforts with the UN, with the government, with our military colleagues. Currently, we're 97 people. We have medical doctors here as part of the USAID team. We have people whose expertise is in logistics. We have people whose expertise is in health. We have people whose expertise is in shelter. We have people whose expertise is communication. And also we have two folks whose expertise is safety and security to keep the DART safe.
Our goal is really to help Haitian women have a voice, help Haitian midwives have a voice, and help them with their leadership skills and networking and organizing so that they can provide the care.
They should have an opportunity to speak more openly about the work that they do because they can make the difference.
Il est prépondérant que l'on puisse avoir des sages-femmes au niveau de toutes les communautés.
Nous travaillons de façon différente par rapport avec médecins obstétriciens gynécologues, côté que nous sommes capables d'aider les femmes, surtout lorsqu'il y a un problème psychologique, lorsqu'il y a un autre problème familial.
Qui angoisse, petit peu, ça veut dire chaque date d'accouchement va approcher, puis j'ai un petit doute, j'ai angoisse, est-ce que je suis capable, est-ce que je risque, tu as parlé de ça, est-ce que je vais mourir?
Dans cette formation, comme en France, il y a des cours théoriques très importants de pharmacologie, d'obstétrique, de gynécologie, de pédiatrie. On acquiert des compétences en réanimation néonatale, on acquiert des compétences dans le suivi de la grossesse, on sait interpréter des résultats d'examen, on sait prescrire. Donc oui, une sage-femme qui sort de l'Institut national supérieur de sage-femme ici en Haïti est tout à fait à même de prendre en charge des femmes.
moi te vle tout et porter contribution PAM pour diminuer quantité moun, quantité femmes qui mourir parce que je me souviens que à cette époque tu as en pile, il était même 630 pour 100 000 naissances. Donc, on était vraiment voulu contribuer à ça.
Depuis mourir en donnant la vie, c'est la devise de la sage-femme.
Good evening. My name is Stephanie Etienne. I'm a midwife and board president of FAM. I'm so honored to be here with you tonight. You know someone who was born into the hands of a midwife. If not you, then certainly your parents or grandparents. Traditional midwives or matrons are and have been a vital part of Haitian society for centuries. But in the past 25 years, midwifery has evolved to a whole other level in Haiti. It is now an internationally recognized bachelor's level education program. Nowadays, you can find midwives working across Haiti in hospitals, clinics, and birth centers. Haiti has the highest maternal and infant morbidity and mortality rates in the Western Hemisphere. The consequences of poor access to quality healthcare are dire to mothers and babies. But we know that countries with integrated midwifery care have lower rates of maternal infant mortality. In fact, midwives could provide over 80% of all essential sexual, reproductive, and newborn health services throughout the country. In 2017, it was projected that Haiti would need 2,200 educated midwives to significantly lower the rate of maternal infant deaths. But still, today, there are less than 400 midwives in the country. Haiti needs more midwives. Most midwives work in extremely busy clinics and hospitals and can see an average of 20 to 40 women per day. Can you imagine the impact of this care on families and communities across the 10 departments? We're talking about thousands of families per day and millions per year. Folks, we don't have to reinvent the wheel. We know what works. Midwives are part of the solution. FAM is here to support the education of more midwives and to help midwives do what they do best, provide high quality care to women and babies. Since 2014, we have been dedicated to creating innovative, dynamic, and most importantly, community identified programming to increase the number of midwives and support midwifery in Haiti. At FAM, nous dit sage-femme pour Haïti Pijam. Our programming is innovative because we are guided by the midwifery model of care. We are midwives to the midwives. We develop responsive programming based on what midwives are seeing in their local communities. Some of our programs include disaster risk reduction, live and webinar-based educational series on gender-based violence, mental health and self-care for healthcare providers, social media training, and local public health campaigns to promote midwifery and women's health in the community. We also work very closely with the Midwifery Association and the only midwifery school in Haiti. FAM is uniquely positioned to do this work because our solutions and innovations are community identified, community-based, and community-led. To put it simply, we center the voices and needs of midwives as well as the communities they serve. Our mission is to support Haitian midwives and midwifery students. We want to promote the midwifery model of care and really position midwives as leaders in the public health sector. We also want to make midwifery care accessible and equitable for all women. We envision a Haiti where midwifery education and professional development are accessible to students throughout the country. And we really want midwifery to be seen as a viable and desirable career option for talented and passionate young people. We are guided by the principles of autonomy, dignity, and sustainability. With support from the USAID and HRA Investor Tank, we will be able to develop programming that will support midwives throughout the country and help educate more midwives. When we help midwives, we help women, the potomita, the pillars of Haitian society. Our work is made sustainable through a set of diversified, unrestricted funding sources. We receive grants from longstanding funders, community-based donations, volunteers, as well as board contributions. And we also rely on strategic partnerships with like-minded organizations to help us advance our mission. Since 2016, we have organized 2 to 4 educational conferences per year, and 220 midwives have attended 1 or more of our conferences to date. FAM has been able to provide reliable support to Haitian midwives throughout the COVID-19 pandemic, natural disasters, and periods of unrest. We do this by maintaining consistent communications with midwives, forming strong strategic partnerships with local and international organizations, and really tapping into local expertise. With this funding, we will be able to increase our capacity and continue empowering midwives to do their work. We will build on and expand our current programs to allow us to continue providing support to midwives, the Midwifery Association, and the School of Midwifery, increase public awareness and outreach in Haiti and beyond, and promote advocacy and policy change related to women's health, gender equality, and gender-based violence in Haiti. FAM is a Haitian and Haitian American-led organization. We are a midwife-led organization. We are deeply invested in the health, wellness, and progress of our beloved Haiti. FAM strongly believes in a woman's innate ability to care for herself and her family. The English word midwife means with woman. And at FAM, we believe midwives are not only with women, but with families and communities as well. We thank you so much for this tremendous opportunity. Merci en pile.
Merci en pile, Stephanie. Belle présentation. Good job.
Thank you.
And I also love the fact that FAM, say FAM and midwives. This is great. All right. Now it's up to you, the judges, to ask some questions to Stephanie. We're going to start with Evelyn.
Thank you. Thank you, Stephanie. Great presentation. I have a soft spot for midwives because you do very important work.
Absolutely.
So my question for you is, could you briefly explain how you understand this, how your project relates to humanitarian assistance or disaster risk reduction specifically?
Yes, thank you so much for that question. So the way we work is that FAM relies on the midwives who are on the ground for guidance. So we do not impose plans without working directly with the midwives. The midwives are the ones in Haiti who are telling us what they need, and we are following their emergency plans. And so they have local groups that are getting together to respond to needs, and they relay those needs to us, and we then provide the support that is requested. And so everything that we do is guided by the leadership that lives in the communities that are most affected.
Good. Jessica, you're next. You're on mute, Jessica.
Sorry about that. I was saying thank you for the presentation. Appreciate that. Interested to hear a little bit more about the challenges that you anticipate in implementation. We know that nothing always, nothing goes as planned. So interested to learn more about how you're mitigating the challenges that you anticipate. Thanks.
Thank you for that question. Well, honestly, we are already facing and addressing challenges on a regular basis. We have for many years, for as long as we've been in Haiti, we've been providing in-person conferences and educational workshops in Haiti. And because of the COVID-19 pandemic, for example, we have not been able to do in-person activities, but we've quickly been able to transition our work to providing very integrated, informative, supportive workshops and teaching opportunities online. And so we've been working with some challenges, but because we're able to consistently stay in communication with midwives, we're always finding ways around those challenges.
Great. It's great that you're able to stay flexible. Thanks
Yes.
for your answer.
Thank you.
All right, perfect. Daniela, you're next.
Thank you, Stephanie. I know you had a slide about the innovative aspect of the project, and I was hoping if you could say a bit more. Specifically, what do you consider to be the most innovative aspect of the project?
From our perspective, the most innovative aspect of our work is that we are guided by midwives. Their agenda is what leads our work. And so we are constantly in a state of communication and going back and forth to make sure that we're fully understanding what midwives need. We really work not to impose what we think needs to happen on a system that already exists. Midwives are already doing really important work on the ground, and we are there to listen to their needs and to promote their vision.
Thank you.
Thank you.
Good. Raymond?
Yeah, Stephanie, great presentations. I see that you cover all the departments in Haiti. So I'm curious as to how do you measure success and define success? How will you measure your impact and define your success?
Thank you for that question. Well, first of all, one measure of success is the number of midwives that we are first able to reach with our programming. Our goal is always to have as wide an impact as possible. So there are midwives in each of the 10 departments. We want to be able to be in communication with all of them. And then beyond that, we want to be able to contribute to the numbers of midwives that are going into training, into education, who are wanting to become midwives. We want to increase those numbers. So just by sheer virtue of seeing more midwives, that for us is a mark of our success, because we are integrally connected to all of the different avenues that are contributing to more midwives being educated. The school, the association, the new education programs that are up and coming, we're connected to all of those programs.
Perfect. Idop?
Yes, good evening, Stephanie. You mentioned, it was mentioned in the actual proposal that there was a desire to fund 2 full-time positions, the executive director and program director. Just curious on how, given with the limited amount of funding for this project, the benefit of funding 2 full-time positions over utilizing the funds for project resources is most beneficial.
Thank you for that question. We are and have been up until now still, we have been working with our executive director and our staff member. And we believe that because they are integrally connected to the midwives on the ground, they're doing a lot of work with the midwives. They are communicating regularly. They're developing programming as soon as midwives are voicing needs and concerns. We're developing programming to address those concerns. We really do need staff to be able to address all of the programming that is coming forward. And so that is why we are really reliant on the 2 staff members. And we believe that with 2 staff members, that will give us enough hands to be able to create the programming that the midwives need.
Thank you.
Thank you.
Good. If there's no additional questions, we're going to move on with the program. Judges, are you all okay?
I have one more I could ask.
Perfect.
All right. So I'm just curious to know, during an emergency, right, how will you identify the most vulnerable people that need to be served?
Okay. So, for example, during the pandemic, we heard directly from midwives throughout the country that there was a strong need for PPE. And midwives were not able to go into work with protective gear. They didn't have enough access to protective gear. And this was an emergency because they had to go to work. They had to be present for people in their community. And so we were able to respond by providing, over the last year, we've been able to provide over 2,000 N95s. We've been able to provide face shields, hand sanitizer, resources so that the midwives can go in and do the work that they need to do. And so again, it was from the midwives that we learned what was needed, and we were able to respond to those needs.
Thank you.
Okay, good. One last one from you, Raymond.
Sure. So Stephanie, as a follow-up from my previous question, you mentioned one measure of success will be the amount of midwives, right, that are in the profession. So I'm curious if whether or not you look at the reduction of infant mortality rate is another measure of success.
Absolutely, absolutely, because we know that an increase in midwifery care will have a direct correlation to infant maternal health. And so we believe that the more midwives that are in the community, the more health we'll see improve in the community as well.
All right, perfect. Thank you very much, Stephanie.
Thank you, everyone.
All right, the judges are going to the scoring board now, and we're gonna take a short break. And when we come back, is gonna be the time to have the pitch from Gaskov. Stay tuned.
Hi, my name is Cozy Joseph. I was born and raised in Lekai, Haiti, and currently live in Palm Beach County, Florida. I am the chairperson and a co-founder of the Gaskov Clergy Foundation, also known as GCF. GCF is a non-profit 501c3 organization. Since 1999, GCF has been providing education, sports program, and access to healthcare to the more vulnerable population of Lekai and its surrounding areas. Our greatest asset is our trusted experience, the infrastructure that we have built, and our resilience in serving our brothers and sisters in Haiti. GCF also has 15 years experience conducting outreach mobile clinics, including raising awareness and on preventing teenage pregnancies and sexually transmitted diseases. As for the past 6 years, we have managed to innovate to build and operate Clinic for Fred, a world-class medical clinic that is now caring for more than 15,000 patients a year. We have, of course, incorporated the teenage pregnancy program at the clinic to help reduce the incidence of teenage pregnancies. To that effect, Clinic for Fred's nurses have been going to local schools to educate and care for young students in the community. Our program has already touched about 500 youth in the communities surrounding the clinic. We would love to scale it to more remote locations with many more young girls and boys at risk. And winning this grant will help us remove our biggest barrier to expansion, which is funding. With the funds from the investor tank, GCF plans to continue to innovate, to recruit more health agents and educators, and to prepare a network of teenage peer trainers who can be a force multiplier for the program for many years to come. Choosing GCF will have a magnifying and visible impact in the lives of the 1,000 boys and girls in Haiti. Help us invest in our children who are the future of Haiti. Choose the future. Choose GCF. Thank you.
Hi, my name is Cozy Joseph. I'm excited to present our teenage pregnancy prevention program, an issue that raises many concerns for us at GCF and Clinic for Fred. Teen pregnancy is really a global humanitarian crisis that is also rampant in Haiti. In the developing world, there are 10 million unintended pregnancies each year among teens between the ages of 15 and 19 years. Can you imagine that 14% of Haitian adolescent girls aged between 15 and 19 are pregnant or have children? Teens having sex without protection are at risk of unintended pregnancy, HIV, other STDs, and even gender-based violence. Furthermore, about 53% of them do not have access to education and healthcare. And for those living in remote areas like Fort Fred and surrounding locations near Lekai, it's even worse. We are proposing a 2-year solution that will strengthen our resources and increase our reach by expanding our existing program to more communities, by developing a network of teenage peer trainers, and by partnering with other organizations to develop and provide access to resources that help prevent teen pregnancies. With this project, we will introduce a peer-to-peer network as a new method that will leverage the experience of teen mothers to their cohort. We will develop culturally sensitive training materials that will provide the teens in our program with the innovation and strategies they need to prevent unwanted pregnancies and STDs and to protect themselves. We will create an environment and community activities that foster dialogues between teenage boys and girls and their parents and family. We will also use technology to identify and link available resources to the community. We are the only provider in the area that is addressing the issue of teen pregnancies. We do collaborate with other organizations. However, no one, to our knowledge, has implemented a program like this. That may be due to a lack of funding and access to resources, which is why we intend to share all of our resources to other organizations who want to do such programs. GCF is a nonprofit organization established to promote education, sports, health programs such as this one. We exist to empower individuals in the communities we serve. We strive to be a philanthropic leader, and our value system is based on trust, respect, accountability, commitment, and empowerment. And now we want to empower over 1,000 at-risk boys and girls and offer them a better future. We anticipate as a much larger number of new beneficiaries as we open the program to more rural communities in southern Haiti. This will become a larger program at Clinic for Fred. As for sustainability, 50% of our revenue is from fundraising and our strategic partners. 30% comes from our lab at Clinic for Fred, and 20% is from the proceeds of the clinic. Grants like this help us expand our programs to more communities. GCF was founded in 1999. We held large yearly medical mission for 15 years that touched over 50,000 families. We stopped doing medical missions in 2015 after we built Clinic for Fred. In 2010 and 2015, we provided relief to victims of the earthquake and Hurricane Matthew. Now our team on the ground has been providing medical and humanitarian relief to thousands of victims since the day after the earthquake in the south of Haiti. To date, we've provided over 2,100 scholarships to deserving students in Haiti. And at Clinic for Fred, we see over 15,000 patients a year. And we provide education and awareness programs on hypertension, diabetes, vaginitis, teen pregnancies, and sexually transmitted disease prevention. With the funds from this grant, we will hire more educators in Haiti to help expand the program. We will recruit 10 to 20 teen parents to become peer trainers. We will develop training materials, pamphlets, and best practices that can be shared with other organizations and help scale and magnify the impact of this one-time grant. We will coordinate school-based and family-oriented educational activities, and we will arrange for transportation for small teams to travel to remote locations for community outreach. Our board comprises of volunteer professionals who oversee GCF and Clinic for Fred operations. Clinic for Fred is led by Dr. Wobi Marsa, a US trained and retired pediatrician, Dr. Fatima Joseph, our lead physician, and Miss Nadine Maydar, our lead nurse, who is also engaged in leading community outreach initiatives at Clinic for Fred. And on behalf of our board and the staff at Clinic for Fred, I thank you for the opportunity to share our story. And remember, when you choose GCF, you are choosing a better future for thousands of boys and girls in Haiti who can avoid unintended pregnancies and sexually transmitted diseases. So choose GCF and choose the future. Thank you.
All right, good job, Kosi.
Thank
Now
you.
it's time for the judges to ask you some questions. I think they have
Let's do it.
A lot of questions. So we're gonna start with Evelyn.
All right, thank you so much, Kosi. I have a question. You propose incorporating teens as peer educators in your project.
That's correct.
Now, to be able to do this, you need to have these teens or teenagers trained and supported throughout the process of accomplishing their tasks. So how will you go about finding and training the ideal candidates for these positions?
Well, the first thing that we will do, we will identify the trainers who will be training these teen mothers, and some of them will come from the clinic, and we will hire some professionals to do that. As for identifying the teens, currently we see about 40 young patients with children at the clinic. That will, and we have their contact information, we know where to find them. That will be a source. Secondly, we will work with the Minister of Health to identify teen mothers or any patients that they've had who are young mothers with children, and that will also be a source for us to recruit. As well as there is one clinic in Lekai who handles maternity, live birth. So we'll also work with them to identify patients from them. Now, as far as the teens are concerned, our plan is really to train them and give them the resources that they need, right? So that they can be effective, as well as give them a stipend so that they can really start to prosper as a part of this initiative.
So just to clarify, the teens that you're using and recruiting to be the educators will come from your pool of program beneficiaries?
They will come from our pool of program beneficiaries and any program beneficiaries from other organizations that we can, draw a number of teen parents. But one of the biggest requirement is that they've been through it. There are teen parents, and they can really articulate the consequences and associated with being a teen parent.
Thank you.
Good. Thank you. Jessica, I think you have a question.
Sure, thank you. And thank you, Cozy. Appreciate the presentation. So you've talked about adapting the Clinic Fund Fred Teenage Pregnancy and STD Prevention Program for the project. Can you talk a little bit more about how this is related to disaster risk reduction?
Well, I'll tell you right now that Clinic Fund Fred is a huge part of disaster risk reduction. Not only do we help mitigate it, but we also are a big part of the response. Okay. Now, as far as reducing the risk, the best that I think this program can offer is enough awareness and training and education to young to teenagers, so that they understand how to protect themselves in the event they end up in a camp, right, where we're seeing a lot of violence against not just teens, against others. So with this program, we are hoping to help reduce that risk by providing the teens with the tools and the education and the techniques that they need to protect themselves in the event that they find themselves, at a camp during a disaster, after a disaster.
Great, thank you.
All right, thank you. Now, congratulations, Kosi. I think the judges will go to the scoring board now, unless we have time for one more questions.
Yes, certainly.
Okay. All right, though.
Thank you for your presentation, Cozy. Appreciate it. Just a question. How have communities been receptive to the pregnancy and STD prevention work that your company has been doing? And also, what data do you have to support the project achievements?
Well, right now, what we do, we go to the local schools and we share, we share techniques, we talk to the children. And in fact, it's not just about teen pregnancies. Even for COVID, we even went about teaching them how to wash their hands, how to protect themselves for COVID. So from that perspective, the schools in the communities have been very receptive to us, because, we really represent a partner for them. And we've been working with the local community, churches, schools, every step of the way. As far as data is concerned, I can tell you that we see about 40 children who come to see a pediatrician with their children who should be seen by a pediatrician. We see that a year. Now, as far as collecting more data about teen pregnancy, that will be a part of this program, because to be frank with you, we have not had the funding to collect reliable data in the area, right? So that we can, use them to collect, but as a part of, so that we can use them to analyze. As a part of this program, we will not only do a baseline, but we will also identify the key metrics that we will use, so that we can understand how much progress we are making towards reducing teen pregnancies and sexually transmitted diseases in the area that we serve.
Thank you.
All right, thank you, Cozy.
You're welcome.
Good luck et bon travail, Juju.
Thank you. It's a pleasure to be here.
Thank you. Nous pratiquement prenons 3 dans 5 organisations que nous gagnons aujourd'hui. Nous étions seulement 2. Nous pourrons le voir tout à l'heure. Nous pourrons prendre un break. Ensuite, nous retourner avec 4e organisation qui va pitch pour nous, c'est Haiti Healthcare Aid. De débrancher.
As you can see, we're currently in WFP World Food Program's central warehouse in Port-au-Prince. It stores rice, yellow split peas, vegetable oil, and other food commodities that will be distributed to communities affected by the earthquake. As USAID DART logistician, I'm supporting partners like WFP Logistics Sector to coordinate partners so they have access to common transport and logistics services to maximize efficiencies and ensure that supplies get to affected communities as quickly as possible. So if you would like to help, first of all, thank you. The best way to help is to donate cash to organizations that are already on the ground and already working together. While well-intentioned, donating hard goods from overseas may disrupt operations that are already ongoing and might not meet the needs that are actually on the ground.
Good evening, everyone. Good evening. Thank you for having me. My name is Rudolph Guillaume. I'm the president and co-founder of Haiti Healthcare Aid Incorporated. HHCA is a diaspora-led nonprofit organization based out of Queens, New York, and operating in Cap-Haïtien, Haiti, which is the northern part of the country. Our problem is basically, as we all know, the healthcare system in Haiti is very limited, and most of its citizens not able to afford affordable healthcare. We at Haiti Healthcare Aid recognize that there's an existing crisis within the human, women and children sector, especially those in the most vulnerable communities. And also, those are the ones that get the least attention from our government. Just some quick statistics for you. 59 out of 1,000 children died before their first birthday. The population of women of childbearing age in Cap-Haïtien area is about 180,000 to 200,000. An estimated 24% of these women face gender-based violence at some point in their lives. About 500,000 Haitians are legally blind. More than 80,000 cannot detect light or have no perception of light. Our solution at HAC is presuming is a threefold solution to try to help with this problem. First, we have a Timuna Santé program, which is TAS, it's called, which is basically a health care-based program out of the schools, where we will go to the schools to screen the kids for dental and vision, treat them, those that need intervention, educate them about their care, prepare them for disaster response through our disaster response program. Second, we have an Edu Santé program, which is a program that educate them about a variety of issues through our partner, HANA-I, which is Haitian Nurses Alliance Association International, where they will cover gender-based violence, general health, nutrition, and much more through a series of both seminars, both live and virtual. The third part is called Nutri-School, which is a program that will screen them for malnutrition to help them give them a meal in school while we screen them for in the schools. Our program is innovative because it comes from the diversity of our partners, especially Hannah I, due to the level of expertise they bring from multiple fronts, especially when it comes to disaster response. They have experts on peds, women health, and the response they had to the earthquake that just happened and this past August was second to none. And we applaud them for that. We also have a strong community connection with our local leaders and local government leaders as well. We have local presence with local employees with low overhead that would allow us to use most of our funds towards our programs. We bring services to the kids in the schools where it's needed the most, and also our partner clinics that would help us with the interventions. Our competitive advantage comes from the fact that we are addressing multiple issues at the same time. We have a diverse team on the ground, which comprises of healthcare professionals, lawyers, technology experts, educators, nutritionists, and community leaders. Our legal status comes to play as well because we're both legal here in the US and we just obtained our NGO status in Haiti. We successfully piloted about 200 students from 3 different schools where 50% of these students showed the need for some intervention, whether it's with dental or vision, because if you can't see, you can't learn. We have MOU signed with over 20 schools now because we started with 3 schools. Now it's about 20 schools that's interested in our program to join in because it's such a big need. We have MOU signed with Hannah I. We have about 15 clinics and local hospitals that are interested in helping with the interventions. We have public-private partnerships formed with local government and local businesses. We've built a network of 30 nurses and doctors, about 10 doctors that are there to serve the communities and the schools that we identified. Our mission is simple. Our mission is basically to save lives while strengthening the health system in Haiti. Our vision actually is to eventually build a state-of-the-art hospital in the northern part of Haiti, basically to help us address any kind of health need that's needed in the area. So basically our people don't have to travel to DR or to Cuba or even Miami to seek medical attention. Our values are simple: integrity, boldness, honesty, trust, accountability, commitment to our customers that we serve, passion, and fun while we're doing it. Our market is huge because the Cap-Haitian area is the second largest city in Haiti, and it's home to about 900,000 people in the northern department. The city itself is about 190,000. So basically, the scalability is there because even though we only piloted 200 students but there is a tremendous need in that area for this kind of program. And our revenue model is simple. Basically, since we're a nonprofit organization, we focus our attention on getting grants, fundraising to fund these types of projects and scale them up, and eventually reach our vision of building a modern hospital. Because we can do it. The diaspora is strong. We are numerous. We're about 3 million diaspora and are living abroad. And our remittances alone basically covers about $4 billion a year. Imagine if we use 10% of that, we can do tremendous things. Our milestones basically it starts from the partners and the tons of experiences that we have and the disaster response space. We had a strong response with this most recent earthquake, especially with helping coordinate the relief with other organizations, with different networks that we're a part of. We advocated for eradication of malaria and HIV last year in 2010 with in collaboration with Nothing But Nets and IOM, which was a UN initiative on Capitol Hill. Through our partners, we've served over 6,000 patients through the years. We've raised funds in collaboration with Combit Santé and other partners on the ground for L'Hôpital Justien, which is the biggest hospital in the Cap-Haitian. We had a very strong COVID response last year and still doing it, where we provided PPE to over 500 people. We work with the local mayor offices and local churches to provide educational materials and videos to the communities. So should we win this grant, actually, we would help us tremendously to scale up our program. Basically, our goal is to see between 2,000 to 3,000 children within a year span to educate, to treat them, I should say, screen them, treat them, and educate them. So here's our team. Our team members comprise of myself, of course, Dr. Marie Hippolyte, who's a member of Hannah I and a consultant. Jacqueline Alcius, whose background is in law and marketing. He's also an entrepreneur. He's our country representative. Dr. Harold Zura, who's a medical doctor who's been in the field for over 30 years. He's a clinic owner as well and a partner for us. And in conclusion, we thank you for the opportunity. Thank you, BHA, USAID, and HRA for this opportunity. And thank you so much, guys. Choose the future of our kids.
Great. Good job, Rudolph. Good job. Great presentation. And now the judges will have some questions for you. And we're going to start with Raymond.
Hey, Rudolph. So first, you mentioned that, one of your competitive advantages is that you are solving for multiple issues at the same time. So two-part question. I'm wondering, how would you rate your success and of trying to solve for all of these multiple issues versus focusing on one? And then secondly, what do you envision collaborating with your competitors to ensure that we allocate resources appropriately?
Great question. First, the reason why all these three came about is because as we did our survey from different community areas, and these were the most prominent needs, and is the fact that we did a little bit of each from different communities. And that's the reason why I figured, should we win this grant, we wanted to touch up on all these three areas, and then would allow us to gather more data so we can scale up in all these different areas, because they're all important, especially when you talk about dealing with young children that needs medical attention, because especially those that cannot see, they're sitting in a classroom they cannot see, and how would they be able to learn? They're sitting in a classroom, they're hungry, they're not paying attention, so they can't learn. Women, because the women aspect came about because there's a new clinic I just opened in the Cap-Haitian area that are taking prostitutes from the street and basically rehabilitating them into becoming part of society again. So we've been working with them in terms of supporting their efforts to help these women come off the streets and also prepare them to reintegrate into society. So that's why these three aspects come about. As far as success, is basically, as I mentioned, we had a pilot with 200 students, and 50% showed need for intervention, whether it was with getting them glasses, which actually we did the follow-ups already, or dental intervention. And that's what, through some of our partner clinics that focuses on dental, we would send them to those clinics to do the follow-ups that are needed, basically at either free of charge or at very minimal cost.
Good. Jessica?
Yeah, thank you for the presentation. So you have identified a number of competitors, and I'm curious to hear more about if and how you've thought about potentially coordinating with these other organizations in the event of an emergency. Thanks.
We actually are very big on collaborating, and that's what I mentioned. One of our advantages were partnerships. We promote partnerships all around. We actually have a lot of collaboration that we've done with other organizations on the ground, but we are open to collaborating with any organization who are willing to scale up our work. And that's the way actually we think that's the only way we think we'll be able to build a hospital in the future, is to collaborating with other organizations in the diaspora as a whole.
Great, thank you.
Thank you.
All right, Evelyn.
Rodolphe, thank you so much for the presentation. One of the things you mentioned that is innovative about your project is the use of technology. Could you just briefly explain how you plan to use technology to reach more people with your health education programs? And what about people who don't have computers or access to mobile phones?
So this is what we do with technology. Like, great question. I'm glad that you asked that, actually. During COVID, what we did to kind of cover all these spectrums that you just mentioned, we had videos that we composed that we basically circulated online, like Facebook, social media, and so on and so forth. And then we also did pamphlets that we were able to pass out with the communities. We used the churches, the local mayor offices, to basically hand out these pamphlets to the communities to teach them about how to wash their hands, what COVID was about. And then we took it one step further. If you didn't know how to read, we hired these are called mobiles, where it's like a pickup truck with speakers that we were basically playing a message on a loop, and we were driving around the different communities to play these messages and talk about COVID. What was it? How to protect themselves? How to guard against it, and how to protect the families and the loved ones. So basically, we try to cover all these different aspects using different ways, different methods to help the communities.
Okay, thank you.
You're welcome.
Daniela.
Hi, thank you so much for the presentation. I just wanted to make sure I was clear about something, and I wanted to sort of go a little deeper into it. So you had mentioned when you were pitching a series of sort of humanitarian or disaster risk reduction activities, ranging from PPE equipment during the COVID pandemic, the disaster relief after the earthquake. I just wanted to be very clear. For this particular project, for these funds, what types of humanitarian or DRR activities do you plan to implement?
Great question. I actually meant to cover some of that during the pitch, but kind of went kind of fast. But yes, so we've always been strong in disaster preparedness. We've actually started to do minor seminars with our network of nurses and doctors on the ground, so they can basically filter that through the communities. That's the reason why we actually partnered with Hana I, because of their expertise and experience in disaster response. Because with them, they'll be able to train the trainer, basically. So we'll work with them to train our nurses and doctors in country, and also to help them implement these programs throughout the community. And that's the way we basically using our partners to help us implement some of these programs. So yes, we've already started doing that, but we'll actually scale up with should we get this grant, with the help of Hana I, to scale up these programs to help educate, because geologists actually are predicting the northern part of Haiti is probably next to be hit with a major earthquake. So we want to be ready and prepare should something like this happen. And that's why we work with the churches. We have partnership with churches, local mayor's offices, local businesses, and we are educating these folks and basically helping us to prepare the community and then for something like this to get a better response.
All right. Good. So this is great. I think we have 4 great presentations, and we only have 1 more left. We're going to take a break, and then we're going to come back with Hope, which is our last pitch for tonight.
generation Haitian American, committed to understanding and learning about the legacy of my people. I wanted to deeply understand the plight of the rural Haitian. And I wanted to do it with the lens of solidarity and the rejection of neocolonialism. Who better to take me down that path than my amazing and dedicated mentor, Dr. Rosemary Clergy. As a native of Haiti, Dr. Clergy founded Hope in 1995 in partnership with the people of the community of Bourne. In 2006, I participated in the inception of Hope's partnership with the Ministry of Health, and Dr. Clergy hired Dr. Tony Voltaire as the medical director, a dynamic and passionate local physician, led by his vow to return to serve the community where he was raised and where he was born. We support the community's vision for health and well-being through Santé dans la Cour, our uniquely Haitian-led model of community health that focuses on understanding and preventing the root causes of disease through education and outreach, and bringing healthcare to people in remote areas out of reach of the hospital. This year, the entire Hope community, both in Haiti and in the US, have joined together as a team to do our part to honor Rosemary's legacy. With your support, we can continue to expand our mobile clinics, continue our teams of dedicated outreach workers, and bring better health to thousands of our friends in a remote fishing town in the middle of the mountains.
I imagine my sister Rosemary sitting on a wall at Bourne, just dreaming about what Dad used to do in that area. He had a coffee farm. And one day she met someone, Dr. Tony Voltaire, who would help in making her, continuing her dream. Together they studied the La Cour and realized the health issues and how they could make things better for the people.
L'idée a commencé après mon retour de l'école de médecine, où je suis revenu dans ma ville natale qui est Boy, où j'ai dû faire face à toutes sortes de cas compliqués. Les patients m'arrivent de tous bords, je ne savais que faire. Là, j'ai compris qu'il faut aller plus loin, aller dans les communautés montagneuses pour voir ce qui se passe. Figurez-vous, en 2005, on était la commune qui avait le pire système de santé. Et depuis 2012, pour arriver aujourd'hui, on est passé à l'un des meilleurs systèmes. Ça, c'est Santé dans la Cour.
Bonsoir. Good evening. Bourne is a beautiful, remote, coastal, and mountainous commune in Northwest Haiti, and it is where Hope has been in partnership with the community for over 25 years. Though breathtaking, the landscape limits many modes of transportation due to the lack of roads, public access to utilities, and technology. Extreme poverty is the reality for many of the Bourne's inhabitants. A trip to the hospital requires several-hour journey on foot through rivers and up and down mountain paths. Those who are critically ill or in difficult labor must be carried by family and friends on makeshift gurneys to address conditions where, if there is a delay in treatment, the outcome can be devastating. Hope's solution is Santé dans la Cour, a Haitian model of health focused on bringing care to the communities in these outlying areas. Santé dans la Cour involves several components, with mobile clinics, clinical staff, and volunteers hike into remote areas, bringing in supplies and medications, obtaining blood work, physical exams, and consultations. Mobile health screenings focused on disease prevention include screenings for cervical cancer, STIs, well child, and prenatal care. Pre-care education and support groups such as mothers' clubs focus on maternal and infant health issues. And we have an incredible outreach and education team, the SEE team, focused on environmental and behavioral factors like water treatment and hygiene and COVID prevention and disaster preparation and response. And finally, Santé dans la Cour relies on community health workers, residents of Bourne who are assigned sections of the commune, who keep an eye on community health members, on the members' health, and leveraging the knowledge of the community in context to conduct health assessments and surveillance and address basic health needs. We are different because we do not wait for the sick to come to us, we go to them. We focus on prevention and overall health and wellness, and we rely on people and relationships instead of expensive facilities and technologies. All of which allows for us to provide care at a very low cost. Mobile clinics can cost about $3,000 to serve about 200 people, and to provide free care for those folks who are unable to pay. We are the only organization providing healthcare in the area. We have a holistic approach to health and well-being with a focus on environmental, economic, and behavioral root causes of disease. And all of our initiatives, priorities, and vision come from the community as opposed to a foreign-led executive team. We have sustained commitment. We do not parachute in, and we do not parachute out. This leads us to our vision and mission, which is simple: community health for Haitians and by Haitians. Our approach has never been, let's get a well in here because there's no water. Our approach has always been speaking eye to eye with community leaders and residents and asking them what they need and asking them what their barriers are and working together to create those solutions. Born is in the northwest of Haiti. It includes the town and surrounding 7 rural districts. It is home to over 85,000 people who live in extreme poverty, and an estimated 85% of the population live out of reasonable reach of the hospital. We sustain our work through many successful partnerships from PEPFAR to UNICEF. We share our model with international visitors who fundraise to support operations. And finally, our long-term view of sustainability is rooted in dismantling the structures of inequity so that Born is a dynamic and self-sustaining community. The health outcomes of Santé Nalaku are our real accomplishments. We served as a trauma center during the 2010 earthquake. Our response to the cholera outbreak resulted in mortality rates that were 1/3 of other rural areas in the country. Our general immunization rates have gone from the worst in the country to the best in rural Haiti. And we've seen documented reductions in maternal and infant mortality rates. Most recently, COVID vaccination rates in Born are several times higher than other areas of Haiti. Humbly, and with your support, we will be able to expand this work and reach the thousands of humans considered unreachable. We can increase the frequency and reach to our mobile clinics and health screenings and fund our SCE team to increase their outreach and programs and hire a nurse to help run our peer education groups. And we can teach this model of care to other organizations committed to bringing health where the community lives. Our team is honored to continue the legacy of one of Born's heroes and one of Haiti's children, the late and sorely missed Dr. Rosemarie Carici and Dr. Tony Voltaire. Dr. Voltaire leads this work with an amazing team of local residents of Born, and our leadership and board of directors and advisors include Haitians, Americans, Haitian diaspora, and members of Dr. Carici's family who understood her passion and comprised experts and practitioners in public health, medicine, education, economics, and environmental health. Thank you for this amazing opportunity to share our story.
Thanks to you, Tony. It's a great presentation and you're doing wonderful work with your organization in Haiti.
Thank you.
We start with the judges. I think I'm gonna start with Jessica.
Thank you, and thank you, Tony. Question, in the interest of doing everything well, you've proposed working on health, on education, you've got economic empowerment. Can you talk about how you can realistically engage in all of these activities and give them each the attention they need to be successful?
Yeah, absolutely. Great question. So one of the things that's important to understand is that the Hope has been in Haiti for 25 years and has established a comprehensive program. And so everything that we've talked about and everything that's in the proposal has basically been things that we just want to scale. They're already done. They're already created. They're already in process. And so what we want to be able to do is to bring them to all of those other remote areas that I talked to you about. The geography of Born, if you look at the geography, it's very difficult to get to the outlying districts. And so we want to be able to get in there and do exactly what we've already done in the town, replicate what we've done in the outskirts, which is about 3 hours away. There's a town called Tibouk, That's about 3 hours on foot. That we have an established clinic and process over there. We just want to take what we've done, we know that works, and bring it to other areas in the community, so we could just make sure that everybody gets what they need. So none of this is actually new. We have foundations in economics, we have foundations in education, and we have absolutely foundations in health.
Great, thank you.
You're welcome.
Okay, Itop.
Yes, thank you Tony, for the presentation. Just a question on the logistics. So I know that's a critical component to the project, as you are planning to have mobile clinics and hospitals reach the community. Can you elaborate on how HOPE has strategically planned to logistically implement this project?
So can you rephrase exactly what you mean?
So how are you going to provide mobile clinics and hospitals logistically? If that's,
okay.
Yeah.
Okay. So there is one hospital in the town, right? And we're not trying to replicate another hospital. That's not the goal. What the goal is, we have a hospital in the town, and what we want to do, and what we have done, and what we do routinely but want to scale, is basically have these mobile clinics going out into those areas. How do those mobile clinics actually get created? Is basically, there's that team, that SEE team that we were talking about, that goes out and assesses. It's like a little epidemiological team that goes out and assesses the community and figures out, what's going on, what are the health impacts, where are the things that need. And so maybe, for example, I'm going to just use Tibouk because it's one of my favorite places. So I'm just going to say Tibouk, there's a whole bunch of pregnant women there, for example. You know what? We need to do some prenatal mobile clinics. So let's do a focused mobile clinic, get all of the things that we're going to need, make sure we have our vitamins, make sure that we have some good education, make sure that we are able to, get a nurse there if we need to, in order to assess whether or not there might be a complication. We might want to take her down to the hospital a little bit sooner, right? Because we are all about preventing complications, and that's where you're going to be able to get your biggest bang for your buck and keeping your community healthy. And so the logistical part is really just doing the assessment, depending on those relationships, that community, going out there. They know what's going on better than anyone, and basically getting from them the information as to, like, okay, listen, I know it's far, it's a 7-hour walk, but we got to get over there. We're going to stay overnight. We're going to figure out what we're going to do. We have our kits ready to prepare. We're going to set up our clinic, and sometimes there'll be a focal clinic. Sometimes it'll be a comprehensive clinic. It just depends on what the needs are in the community, that the community workers that are there are telling us that they need.
Perfect.
Hope that answers your question.
Itop, are you satisfied?
Yes, thank you.
All right. Good. Okay, we're moving on with Daniela.
Hi, Tony. Thank you very much. When I read your written application, there was a heavy emphasis on social networks. And I wanted to ask you a bit more about that, because I didn't hear specifically about it in your oral pitch. So given the role of social networks in executing and implementing your project, how do you plan to reach out to sort of the most marginalized communities, or those who are not within your existing networks, or the networks that are in your community? Thank you.
Yeah, absolutely. I love this question, because you have to know Born to know that, like, there's nothing that's happening that other folks just don't have an idea. I want to give you an example, if I have 30 seconds, just to give you an illustration, and then I'll try to see if I can elaborate a little bit better. One of the times that I went there, I was on my way to a mobile clinic, and I had like a little mini accident. It wasn't a big accident. I just fell in the mud, and I was in mud from head to toe. I was 2.5 hours out. By the time I got back to Born, everybody was like, Dr. Tony fell and died in a mud bath. Like the everything, they had already known, and they were already ready for me to be like actually taken care of and prepared. And so that's just an example of the fact that there's not like, we are so deeply embedded in those communities that the information that we need for those remote areas, it's gonna trickle down. It's going to get to us in one way, shape, or form. We want to do it better, right? There's always room for improvement. We want to be able to do it better. We don't want to be late, right? And so we're anxious to get out there and to make sure that we're able to make sure that there's no stone left unturned. And so the way that we do it was, like we said, we base on those social networks. Those community health workers are coming from all of those areas. Nobody's coming from outside of those areas. They know that place backwards and forwards. They can tell you where to go. They can tell you that the road is down, you need to go around. They can tell you exactly what you need to do in order for you to reach those folks. And so heavily depend, like the social network, it's the whole thing. It's the whole process.
That's good. Remo?
Yeah, thanks, Tony. It definitely looks like people play a very important role in really driving the success that you're having, especially when I'm hearing going from worse to first and some of those measures. So as you think about expanding, I'm just curious to know is how will you know and what measures do you have in place to ensure that you have the right people for the job as you're expanding into these remote communities?
Yeah, so as a physician, right? Like we're looking at outcomes and we're looking at making sure that we're saving lives, and we're making sure we're looking at rates of folks that are coming with certain diarrheal diseases, for example. Stuff that people shouldn't have. These are preventable things, right? And so you want to make sure that you're looking at reducing the rates of all of the illnesses that are ravaging folks and that are preventable, that you have care for them. And so what we're able to do from that point is that once we're able to actually see a difference in the numbers, and they're very meticulous about their data. Once we start to see that there is a decrease in those numbers, then we feel good that we have the right people, we have the right training, right? Dr. Voltaire is an incredible human, an amazing person. He's a great physician. He oversees all of the operations. And so it's not just, it's basically his feedback is looking at the data and saying, okay, look, it looks like there's a problem over here. We're going to have to fix it. This is ridiculous. Or, you know what, we might need to tap into a resource because we don't have what we need. Let's talk to our partners so that we can leverage some resources, right? And so it's basically, what is so beautiful about this organization is that everything is literally like Haitian led. We don't need other folks to tell us what to do, right? We know what the community needs. We just need to listen, and we just need to get quick and mobilize exactly what we need so that we can spread it out and get out into those very remote areas so that there is no stone left unturned. And there are no tragedies, right? We're here to try to avoid tragedy. And that's what we want to do. We want to take care of everybody. Health is a human right.
All right, that's good. So we just had our 5 presentation. Thanks to Marie-Yolène Toms from Community to Community, Stéphanie Etienne from Foundation of Advancement of Haitian Midwives, Cozy Joseph from Gaskov, Woodolph from Haiti Healthcare Aids, and we just had Tony from Hope. Judges, how you feeling? Good? All right, perfect. Now I know that you're gonna go to the scoring board. This is the last opportunity to vote for those organizations for this category. But at the same time, the audience will have the opportunity to vote starting midnight tonight till Sunday. So we're gonna take a break. We're gonna show you how to vote, and then we're gonna come back with the scores for all those 5 organizations.
In July 2021, the Haiti Ministry of Public Health and Population published its 10-year health plan. Built around the principles of universality, globality, equity and quality, and the values of right to life, right to healthcare, solidarity, citizen participation and efficiency. The document outlines the country's goals of improving its healthcare system and implementing a universal health coverage. To achieve these noble goals, multiple challenges must be overcome. Haiti has been struggling with sanitation. Food insecurity remains a major issue. more than half of the country's rural population still lacks access to drinkable water. Access to healthcare facility is very limited. Since 2017, the government has decreased its investment in healthcare. Other systemic problems such as lack of health education, social disparity, structural violence, cultural factors, constantly strain the health system. The progress made in certain categories must be consolidated. Life expectancy at birth is averaging 64 years, up 2 years since 2010. The infant mortality rate fell from 51.772 to 50.509 deaths per 1,000 live births. 657 deaths and less than 23,000 cases related to COVID-19 have been reported to date. Massive efforts need to be undertaken by all the actors involved in the sector to strengthen the institutions and the coordination between local and international partners, to provide the entire population, and in particular the most vulnerable groups, with quality healthcare and services that meet their needs, to ensure the availability of a pool of motivated, competent and performing health workers across the health system, to strengthen the production, analysis and appropriate use of information for informed decision-making within the health system, to ensure the availability and use of safe and quality medical products and technologies, in support of the delivery of healthcare and services, to promote optimal mobilization and use of financial resources in support of the health sector. Haiti can be healthier mentally and physically. A lot needs to be done to revive its health system. To vote, go to investortank.org/vote. Scroll down and check the organization's pitch presentations. Select the best organization, click on the name and click Vote. Enter your email address and click Send. You can check the results after your vote. You can also share it on social media.
Our goal right now as a DART is to work with our partners and work with the government to get what hasn't been identified, humanitarian aid sectors that have been identified, get that out as quickly as we can. One example is over the weekend and today we have provided resources for the World Food Program. They are currently, at this moment, distributing food to over 5,000 people in Manich. This is an area we traveled out over the weekend. We are also providing resources to Catholic Relief Services and Mercy Corps, again, to provide most supplies that are needed for those most vulnerable as we speak. We are in the process of working urgently to transport supplies with our DoD colleagues Coast Guard, Department of Defense, food, hygiene kits, plastic sheeting needed for temporary shelters. And we've been doing that for the last few days, and we'll continue that for the next few weeks.
All right, make sure to check out onediaspora.org. Nous toujours suivre deuxième pitch compétition gros coquin chaîne concours ça Investor Tank ou avez toute information online si vous allez et là assurant seulement parler de santé, semaine passée on a parlé de agriculture avec business, semaine prochaine on va parler de logement shelters. But qu'on y a you know qui est important c'est que juge pour le voter, nous va le dire comment juge voter, comment chaque organisation peut être impressionné juge plus ou moins par rapport à score que juge bayo, mais après ça, c'est à minuit que vous êtes capable de voter ou même pour organisation pour là. 5e place, 5th position tonight is GCF, Gaskov Clergy Foundation, with 113 points. You can see how the judges voted, and we put the numbers together, and Gaskov Clergy Foundation fait 113 points à swear. That's good. Congratulations, GCF. 4e position qu'on y a, 4th place is FAM with 115 points. FAM, c'est organisation pour avancement sage-femme haïtienne. Yo fait 115 points, juge voté, et c'est ça qui total là à soya. Congratulations, FAM. Mais comment juge voté? Nous compiler tout point yo, et il fait 115 points. De parti pour 3e place, 3rd place now. Hope, Haiti Outreach Projet Espoir with 117 points. 3e position, mais comment juge voté, nous compilez yo, il fait 117 points. Congratulations, Hope. Good. And we're going to move to the 2nd place. 2e place, I swear, c'est Haiti Healthcare Aid, 120 points. Congratulations, Haiti Healthcare Aid. 120 points. Juge voté, nous compilez li, et you fait 120 points. Congratulations. And the organization, the pitch with the most points tonight is Community to Community. It was obvious since nous te get après 4 déjà. Community to Community fait 125 points. Mais comment juge voté et compliment à tout gagnant. Combien juge voté pour organisation. So the pitch competition is not over. So starting today at midnight until Sunday, October 24th at midnight, you can go online on Investor Tank vote so you can vote for your organization. Semaine passée, nous avons plus que 8000 votes. J'espère que année ça nous doubler jusqu'à tripler ou bien quelque soit ça nous fait à semaine ça pour organisation qui dans le secteur santé. Donc, je vais être là pour vous. Et puis, bien sûr, on a tout annoncé que nous avons un 4e show qui sont shows qui pourra le bail résultat pour toute catégorie. So, thank you very much. Thanks to everyone, the judges, the contestants. And I will see you next week for the shelter competitions. In the meantime, wait till midnight and go vote. Thank you, everyone. C'est un plaisir. Karel avec nous. See you Tuesday.